Welcome everybody to the Hypertrophic Cardiomyopathy Association's Facebook page. It is October 17th at about 5 after 3 p.m. Eastern Time. So if you're watching this broadcast at a later date and you ask us a question, we're not going to be able to answer it live, but we will try to get back to your printed questions at a later date. Today, I'm happy to announce that the Hypertrophic Cardiomyopathy Association is adding another Center of Excellence to our family of HCM Recognized Center of Excellence programs. And today we're going to be learning a little bit more about Cleveland Clinic in Weston, Florida. I know many of you are familiar with Cleveland Clinic in Cleveland, Ohio, but they're the satellite program down in Florida. And now we have an opportunity for patients in the South Florida area to receive their care closer to home. So without further ado, I'm going to introduce Dr. Craig Asher, the director of the HCM program at Cleveland Clinic Weston. Welcome, Dr. Asher, to our Facebook page.
Well, thank you very much. I want to start saying that here at Cleveland Clinic in Florida, we're really delighted and honored to be part of the HCMA.
We're very happy to have you, even though you and I have been working together for quite a few years now, including your time back in Cleveland Clinic, Ohio. So why don't you tell us a little bit about how the program in Cleveland Clinic Weston got going and how you ended up down in Florida?
Yeah, sure. Well, my interest in hypertrophic cardiomyopathy started over 25 years ago when I was at the Cleveland Clinic in Ohio. I was mentored by Dr. Harry Lever, who I'm sure many of your members know very well. Dr. Lever is passionate about understanding and caring for patients with hypertrophic cardiomyopathy, and he instilled in me those same qualities, curiosity, interest, and commitment for taking care of patients with hypertrophic cardiomyopathy. I worked in Cleveland, Ohio for 12 years, and 14 years ago now, I moved down to Cleveland Clinic in Florida and have continued to have a primary focus both clinically and academically on caring for patients with hypertrophic cardiomyopathy.
So you got to work with Dr. Lever, one of our favorite people, and I'm sure he taught you a great deal about HCM, and I'm assuming that your collaboration and your work with him continues to this day?
Yeah, absolutely. As I said, Dr. Lever has been a wonderful friend and mentor over the years, and I still very often give him a call all hours of the day, and he helps me out with some difficult situations.
He's a good guy to have on your team. So tell us a little bit about how you formulated a plan to become a full center down in Florida.
Yes, well, actually, we are just recently, of course, designated and organized as a full center, but actually, we've been seeing a high volume of patients with hypertrophic cardiomyopathy now for many years. I'd estimate that we see over 300 patient visits a year and are very likely the busiest HCM center in the state of Florida. We are an adult care hospital here in Cleveland Clinic, Florida. We don't have pediatrics, we don't have obstetrics, but we do have a multidisciplinary cardiology team. Includes heart failure. We do heart transplants here at Cleveland Clinic, Florida. We have experts in EP, cardiac imaging, including cardiac MRI, and structural heart disease. So we do alcohol ablations at this facility as well. Myself, Dr. David Lopez, Dr. Gian Navarro, our clinical cardiologist, and we see most patients at their initial visit and then work them through the system.
So you brought up a couple of names there and a couple of specialties. I find it interesting that Dr. Lopez actually was trained by Dr. Chris Kramer at UVA and also trained with Dr. Jorge Gonzalez at Scripps. And we have this amazing national network of MRI specialists, all hopefully going to be working together to further our knowledge and advance our understanding of the role of MRI, which we'll talk about in a few minutes. So you have this team, but you have an interesting component to your team in that we have a connection with a certain surgeon from Cleveland Clinic, Ohio, who's going to maybe make some appearances down in Florida. Why don't you tell us a little bit about that aspect of the program?
Yeah, absolutely. This is a very exciting announcement for us to make. That Dr. Nicholas Madeira from the Cleveland Clinic in Ohio will be coming down to Weston here in Florida and doing myectomies for us. He'll be coming down on an as-needed basis. He'll train some of our cardiac surgeons here. I'm sure many of your members at the HCMA know that Dr. Madeira is among the most experienced, highest volume myectomy surgeons in the country and probably throughout the world. So this is a wonderful asset to our program, and we're very excited to have Dr. Madeira on board.
Yes, I remember when I came down for the site visit almost a year ago, and we talked about how we're going to deal with surgery, and the idea was to put people on airplanes and send them away, which didn't seem to make a lot of sense for the masses of residents in South Florida to have to fly away to surgery when we had another option potentially there. And I'm really excited for the patients of South Florida that we have this phenomenal option of bringing him to the patients and then training up the people at Cleveland Clinic Weston to know the other side of myectomy and the recovery aspect. But I think that is a phenomenal opportunity for the people of South Florida to have somebody of the caliber of Nick Madeira to be able to come in and do their surgeries. And I do believe that he'd probably maybe hope that most of those surgeries were sometime between January and March most years, so that he can escape Cleveland and that lovely weather up there. But I'm not sure it's going to work out that way, but I think he'd probably like it. So I think the world of him, and I think your program is going to be very well served by him. What else can you tell us about the team in terms of, are we going to be able to do AFib ablations down at Cleveland Clinic Weston? How are we going to handle your EP patients?
Yeah, absolutely. Our EP team is very experienced. Many of them have trained in Cleveland Clinic in Ohio. We do all procedures, including AFib ablations. And they're also very experienced in risk stratification for sudden cardiac death, which is a very important issue and one of the most complicated problems that we face.
So, talking about that particular issue, what do you find challenging about managing HCM, and what are some of the tools you use to navigate through some of those challenges?
Yeah, I think number one on the list in terms of challenges of caring for patients with hypertrophic cardiomyopathy to assess the risk of sudden cardiac death. This, of course, is the greatest fear of any patients and of physicians. It's one of the most common reasons for referral to a center of excellence and to particularly to the electrophysiologist. We have used many of the clinical tools that are available from the American Heart Association, as well as the recent European Society of Cardiology risk calculator. In my opinion, these are good tools. They give us information. However, they still have some limitations. And we acknowledge that this risk assessment is still unpredictable. Fortunately, I believe that cardiac MRI has been a major breakthrough. We use it regularly. We use it in almost all of our new patients with hypertrophic cardiomyopathy. It allows us to further characterize the wall thickness with more precision. But most importantly, it tells us about the percentage of scar tissue in the heart. And this scar tissue percentage is a very powerful predictor of who's at risk for sudden cardiac death. And so we weigh this very heavily in the decision of who would require a defibrillator.
So the new data that's out about LGE, late gadolinium enhancement in hypertrophic cardiomyopathy, you're a believer, as am I, that it's a major game changer and it's going to help people.
Yeah, absolutely. It gives some quantification to the determination of risk. The clinical criteria sometimes are just not good enough. And I find this MRI data very compelling and very helpful in making these decisions.
Couldn't agree more. Couldn't agree more. And one of my favorite questions to ask physicians who treat a lot of HCM, although these are more pipe dreams, where do you hope to see HCM care in the next 5 to 10 years? Do you see any changes? Do you have any hopes and dreams? Do you have any fears? Where do you think we're going?
Yeah, I think I do. I have some dreams regarding care of patients with hypertrophic cardiomyopathy. As I sit in the echo reading rooms and look at echoes every day, it strikes me that we're often looking at the late stages of a disease. We see patients with severe hypertrophy, with LV dysfunction, with pacemakers, defibrillators, AV nodal ablations. And what we really need to focus more on is the earlier stages of the disease. If we can identify who's at risk or identify patients earlier on in their disease, either by genetics, by laboratory markers, by cardiac imaging, then the hope is, the dream is, that we will be able to find ways to target the underpinnings of disease, pathophysiology, perhaps with medication, so that we can prevent some patients from going down this path toward more advanced disease.
Well, that's a nice dream to have, and we would hope that that plays out. We all know that there's some clinical trials going on right now. Maybe some of those drugs will prove helpful. Maybe some older things that are in our toolbox will prove helpful as well. So a question we didn't quite prepare for, but I think I'll ask anyway. If a patient were to set up an appointment and come down to Cleveland Clinic for an evaluation today, what type of time frame are they talking about to get in to see you and to the rest of the team? And how much advance notice should they try to provide to get a good appointment?
Well, I think we've got access to I think to see most all patients within a week, 2 weeks, the most. Won't always be me, but the team is growing, and I mentioned some of the other clinical cardiologists that are also quite experienced and involved in our program. And also, aside from our clinical cardiology team, sometimes we can identify specifically ahead of time where patients may need to go. In other words, if it's more of a primary problem with atrial fibrillation, we may have a plan to to see the electrophysiologist as a first visit. But I don't think there should be any problems with access, and if there are, I'm sure you'll let me know.
I sure will, because I do that kind of thing. So most patients can get in a couple of weeks period of time. And for those snowbirds that are going to come down to South Florida just for the winter, probably they want to make an appointment before they leave home if they want to make sure that they've got an HCM health home down in Florida. That would be a good idea?
Absolutely.
We don't want to meet them in the emergency room if there's a problem. We'd like to meet them ahead of time, would be my guess.
Yeah, agreed.
That would be good. Okay, well, I'm going to open the floor to questions if anybody has some. We have a couple of viewers watching us live. The rest of them are going to be watching it afterwards, and they're the ones that are always going to pop the good questions up that we're not going to get a chance to answer live. But if anybody does have any questions, we're more than happy to answer them right now. And while I've got you here, Dr. Asher, I just got some really exciting news that I've been working on for, no joke, 20 years. And I'm going to publish a survey to our community in a little while. And it may not sound like a big deal to some people, but it's a big deal to us. We have identified an insurance carrier who is willing to write life insurance on the members of the HCMA who have predominantly been uninsurable. Now we're looking at ways to dovetail the membership of the HCMA with a small life insurance policy and the ability to buy more life insurance. So 20 years in looking for somebody to write us a group policy, and it looks like it's actually going to happen, which gives our families a little bit of reassurance and some security in knowing that they'll at least have something there that they wouldn't have otherwise. So very excited about that. If you're viewing now, this is late breaking news. It's not official yet. We haven't signed the contract, but we've got somebody who said, yes, they'll write the policies. So 20 years, I never thought we'd actually have the day, but we've made it to the day. So yay, sharing a little news. So we've got some people saying hello to us. Penny and Berta are saying hello, but we don't really have any questions today. We'll give you one last chance to post any questions that you want to Dr. Asher or to myself, and we'll answer them. Dr. Asher, any parting thoughts with us before we wrap up here today?
No, again, we're just really delighted here to be on board with the HCMA, and again, I appreciate all your support over the years. I know we've known each other for, as you said, probably over 20 years, and it's been a long journey. And once again, I want to congratulate you on all your wonderful accomplishments in promoting this organization. It's quite remarkable that patients, many of the patients that come to me, they know you by name. They come with questions that Lisa told me to ask you this. And I again congratulate you on being such a passionate advocate of patients that have hypertrophic cardiomyopathy.
Well, thank you for that, but it's a partnership, and you were there in the very, very early days. You were the junior guy next to Harry Lever, who saw the patients on the overflow there, and I can imagine that had to be quite a learning experience working that closely with Dr. Lever. He still remains one of my favorite people, and he is a fantastic teacher. Although his mannerisms might not necessarily be as orthodox as some might imagine, he has a way of making you learn a lesson and never forget it. So you were taught by somebody who I admire a great deal, and I know we've been sending you patients down to Cleveland for many, many years, and they've all done quite well, considering, not everything always works as you want it to, but you've had the opportunity to work with some pretty complicated patients and help them get on the right path. So we appreciate you being there for all these years. Oh, we have another comment from Tristan. Good to see you, Dr. Asher. Thank you for all you've done for me. So I guess that's one of your patients who's popping in to say hello. So it's always good to hear feedback, and we always get some great feedback from the patients who've seen you down in Cleveland. I always want to call it Cleveland, Florida, because it gets confusing because of the name, because it's a town. But down in Weston, you have a beautiful campus. You have a fantastic support staff who I know are there with you. So thank you to them for helping us get this done as well. And we look forward to our continued collaboration. And to anybody who has any questions for Dr. Asher, all you need to do is look at the link above, and that will give you the contact information to the Cleveland Clinic Weston. And you can set up your appointments, whether you're a snowbird or you live there all year round. I encourage you to set up an appointment in advance so nothing becomes urgent. It's good to get to know your new physicians when things are calm and steady so they understand who you are and what your goals and objectives are. So we encourage you to do so soon. And Dr. Asher and team, thank you so much for joining us today on the HCMA Facebook page. Have a great day.
Okay.
Thanks.